PRP is platelet-rich plasma. So it comes from the platelets in our blood. Our blood has platelets. The platelets are those things that when you cut yourself, they come in and they form a scab. A whole bunch of platelets come in, they form a scab, they stop the bleeding, and you don't bleed to death. So that's the one positive thing that platelets do. But platelets also have growth factors. So they release the growth factors, and those growth factors stimulate new blood vessels and cells to come in the area. So these growth factors are basically like rocket fuel to help with the healing. So now, what if we take a bunch of blood, and not a ton, not as much as you would take even from like a normal blood donation, which might be 300 cc's, like a pint. Okay, it's 60 cc's compared to 300 cc's, so it's on average. And so you take a little bit of blood, we spin it down in a centrifuge, which is kind of like a washing machine, and the red blood cells, the white blood cells, the platelets, the fluid, the proteins, they all separate out because they have different weights. The platelets are a little white layer. We take the platelets out, the concentrated platelets, and we'll inject them into areas of the body that we want it to try to get to heal faster. Because remember, it's like rocket fuel or jet fuel for healing. It has growth factors. So we're concentrating all these growth factors, and in the instance of the knee, injecting them into the knee to stimulate the knee to heal itself. It does not grow back cartilage either, PRP, but it does help the inside of the joint heal and work better. And it does tend to last longer than a cortisone shot or gel injections. So on average, probably, and when I say on average, it's probably like 80% of people get a cortisone shot, it lasts 6 weeks. 80% of people who get gel injections, it lasts 6 months. 80% of people who get a PRP injection, it'll last a couple of years. Some people last a lot longer, some people won't last quite as long, but it's on average, it's about 2 years, 80% chance of 2 years. Now, the cool thing about PRP is we're using your own body to heal yourself. This stuff isn't manufactured in some lab or some factory. It's not artificial. It's your own blood. We're just concentrating it. So that's the amazing thing. That's like I said, our bodies have this ability to heal ourselves. As we get older, it's not quite as good. And so we can take our blood and concentrate it and help our body heal itself a little bit faster. When you're younger, the PRP tends to actually be even stronger. So in a teenager who tears something or sprains something, it works really amazing. As people are 30s, 40s, 50s, 60s, 70s, 80s, etc., it may take more than one injection to notice the full effect. Maybe one, two, three. Especially if we're dealing with a tendon, which a tendon attaches muscle to bone, like at the elbow for a tennis elbow, it may take a couple, 3 injections if you're older. But for a knee, a lot of times one injection might even last a couple of years. And so, like I said, it's not going to grow back new cartilage. It's not going to cure the arthritis, and it's not going to take care of if there's a bone problem in the knee.